everyone. It's me, Carly Burridge, founder and owner of Gaining Health, where we provide resources and tools for clinicians who want to start or optimize an obesity medicine practice or clinic. So every Wednesday, we do an episode called What's Up Wednesday, where I discuss either recent journal articles or books that are released on the topic of obesity and talk about how we can integrate this information into our clinical practice. So I'm very excited to be discussing this recently released book today. It is called A Clinician's Guide to Discussing Obesity with Patients. And the author is Sandra Christensen. And it's now available on Springer.com, Amazon, Barnes & Nobles, or wherever else you may buy your books. And this is a very practical guide on how to initiate and how to continue a respectful, skillful discussion about obesity with patients. And this is so important because we know from studies like the ACTION study that one of the barriers to addressing obesity for clinicians is that they don't know how to bring up the topic of weight. And they often fear offending the patient when they bring up the topic. And so in this book, the author briefly discusses the pathophysiology of obesity and some of the evidence-based tools that we have available to treat obesity. And of course, this is very important when discussing obesity. This knowledge is essential, and it definitely contributes to reducing weight bias and stigma, which the author also discusses at length in the book. However, the knowledge of the science and the treatment tools alone is insufficient to really effectively treat a patient with obesity. Because as anyone who has run a successful obesity management program will be able to tell you, it's not just the what and the science that matters, but also how. It's how we communicate with our patient. And I would argue that that really is the difference between a successful practice that flourishes and a practice that fails. It's how we are communicating with our patients. And I have witnessed numerous programs that have been started by large hospital systems. They were well funded that failed. And why do they fail? If you ask me, I mean, it's not like there's a shortage of patients, right? I think it's really that they're not communicating effectively with their patients. Learning the science about obesity is fairly straightforward, but learning how to build that rapport with your patients and unlearning some of the communication styles that were taught in our medical training, where we're the experts and we tell patients what to do. This is also known as the writing reflex. Unlearning some of that is actually much more difficult. And communicating effectively is an essential skill to learn if you truly want to help your patients and if you want to have a successful program or practice. So Sandra really does a fantastic job of breaking down how to communicate effectively with patients and how to facilitate that behavior modification. And she really gives excellent examples and clinical scenarios in her book to illustrate how to apply the information that she shares in her book in your clinical practice. So I would recommend this book to anyone who either wants to practice obesity medicine, is already practicing, but they feel like they could optimize their program, and or maybe they need tools to help train their staff and clinicians as their practice grows. But also for all clinicians and educators who may not necessarily feel comfortable treating obesity, but they need to know how to effectively start that conversation and have a conversation with their patients around weight so that they can refer their patients to the right resources to address this super important health issue that affects over 236 other medical conditions. And we really can't continue to ignore obesity or to avoid the conversation with our patients because we feel uncomfortable initiating that conversation. But it's so important that when we do initiate that conversation, that it's done in a compassionate, skillful manner. And this book really teaches you how to do that. And lastly, this book is very near and dear to my heart because the author is a dear friend, and I was fortunate enough to have her as my mentor at my very first obesity medicine conference back in 2013 or 2014. And Sandra Christensen, she is a trailblazer and a thought leader in this field, and her voice and her passion really resonates throughout the book. And her writing is beautiful. It's almost poetic at times. So this book is really just a joy and an inspiration to read. And I believe in this message about communication very strongly, so much so that I dedicated a significant section of my book developing an obesity management program, the healthcare provider's roadmap, to the topic of how to communicate effectively with patients. And so this book really goes into a lot of detail on this topic. So again, it's called A Clinician's Guide to Discussing Obesity with Patients by Sandra Christensen. So if you want additional resources and tools on how to start an obesity medicine program, please check out our tools available at gaininghealth.com. And thank you, everybody, for checking back in. And I hope to see you all back next week for another episode of What's Up Wednesday. Take care. Bye.